Hello, and thank you for joining this evening's webinar on public health and pesticides. I am June Wallach, a member of the Town of Mamaroneck Sustainability Collaborative. The collaborative is a volunteer committee that's organized to advise the town on environmental issues. And our Larchmont-Mamaroneck Healthy Yards project is an initiative of the collaborative dedicated to helping residents enjoy safe, appealing, and sustainable lawns and gardens. You may be familiar with the Healthy Yards signs displayed throughout our community, which indicate locations where residents have committed to avoiding the use of pesticides. We are so pleased to welcome our guest, Dr. Sarah Evans, Assistant Professor in the Department of Environmental Medicine and Public Health, Icahn School of Medicine at Mount Sinai. Dr. Evans will share science-based evidence about the impact of pesticides on children and adults. She's a trusted voice on the health effect of toxic chemicals and steps individuals can take to protect themselves. She's uniquely qualified to share a perspective on this subject. Dr. Evans earned her doctorate in neuroscience from Weill Cornell Medical College and her master's in public health from Mount Sinai, where she completed a 3-year fellowship in environmental pediatrics. Dr. Evans is a member of an innovative team that studies the impact of environmental chemicals to help better understand and prevent diseases that arise from them. We will have time for a question and answer following Dr. Evans' presentation. Please put your questions into the chat box. This evening, we will be addressing questions that are specifically health related. Questions about yard care can be addressed in follow-up or by visiting the Larchmont-Mamaroneck Healthy Yards webpage at www.lmhealthyyards.org. Thank you, Dr. Evans, and please get started.
Thank you so much, June, for inviting me to speak. So as June mentioned, I'm an assistant professor in environmental medicine and public health at the Icahn School of Medicine at Mount Sinai. And tonight I'm going to tell you a little bit about the work that we do at Mount Sinai and explain to you some of the science behind why we have concerns about children's exposure to pesticides. And I'm hopefully not going to speak too much so that we leave enough time for your questions at the end. So at Mount Sinai, we work as a multidisciplinary team. So we're not only doing research, we're also healthcare providers, and we work with community members, advocates, and decision makers to prevent and treat diseases that result from environmental exposures, and we promote safer practices and policies. And we do this work because uncovering the role of environment in child health has become increasingly urgent as chronic diseases like asthma, diabetes, food allergy, childhood cancers, and developmental disabilities have been steadily increasing over the past 2 decades. And these rates are rising faster than can be accounted for by genetics. And we know from studies of identical twins, where one twin goes on to develop an illness and the other does not, that nearly all diseases have an environmental component. And our research shows us that children are not just little adults, and the exposures that they experience are likely contributing to the development of diseases across their life course. Because of their physiology, children are disproportionately exposed to pesticides and other chemicals and are more vulnerable to their health impacts. So they're closer to the ground where pesticides settle in dust and soil. They're more likely to put their hands in their mouths. They breathe faster than adults, so they're at greater risk for inhalational exposures. They also eat a less varied diet. And so, we often think of the things that are most heavily contaminated with pesticides, like strawberries and apples, are a major part of children's diets. And they also eat and drink more for their body weight than adults do. And so all of these normal behaviors likely account for the fact that we see higher pesticide exposures in children. And we know that the chemicals that we use on our lawns and in our homes get into our bodies. So the National Health and Nutrition Examination Survey, or NHANES, is a study that's conducted by the CDC every other year on a representative sample of the US population. And they look at children beginning at the age of 3. And they find more than 200 chemicals that we use daily in consumer products in our homes and on our lawns. in the blood and urine of nearly all Americans. So this is proof that these chemicals are getting into our body either through ingestion or inhalation or skin absorption. And many of these exposures are highest in children for the reasons that I outlined, as well as highest in Black and Brown communities. And despite the fact that exposure is so widespread, understanding the health impacts of these cumulative low dose long-term exposures is actually really challenging. And so because there's this great complexity in how we experience multiple low dose exposures every day of our lives, to truly understand how the environment impacts health, we consider what we call the exposome. So this is all of the things that are outside of our body and inside of our body that combine to influence whether we get sick or whether we stay well. And so typically in environmental health research, we would examine one chemical at a time, one pesticide at a time, for example. And so a lot of what we know about how pesticides affect health come from earlier studies where we would think about one chemical at a time. But we actually need to think about how the chemicals that we're exposed to through our foods and in our homes interact with things like our lifestyle and our social support networks and what other pollutants we're exposed to in combination with our genes and all of our individual makeup to really understand how the environment is impacting health. And so I'll give you some examples of what I'm talking about. So when we think about the exposome, we take into account individual differences that affect disease risk. So when you read headlines that a particular pesticide, for example, is associated with cancer, you have to understand that those studies are done at a population level. So not everyone who is exposed to something will go on to develop a disease. And so the way that we're doing our research now allows us to look at the individual person and understand their disease risk and then try to prevent it. And so this is an example where we think about pesticides and how different people can be susceptible to pesticides in different ways. So the organophosphate pesticide is an insecticide, and it's processed by the liver. And so depending on which version of the particular enzyme that you have in your liver to process organophosphates, either one that's very active, that gets rid of the organophosphate very quickly, you may not suffer health effects from exposure. But if you have another version of this gene, which is called PON1, then you're less efficient at processing the pesticide in your liver, and you develop more toxic metabolites. And this is associated with learning and behavioral problems and neurodegenerative disease. So we have to consider the individual as well as the chemicals that they're exposed to. And so when we think about exposomics, we're also thinking about timing. And so how old you are when you experience an exposure also matters. And this is where we see some of the greatest impacts of exposure when they occur during fetal development and early life. And these are what we refer to as windows of susceptibility. And these are periods of time when developing systems are most sensitive to perturbation because they're changing and growing rapidly. And that change in growth really occurs into the second decade of life. So we're not even just concerned about the youngest children, we're also concerned about teens and adolescents and young adults as being particularly vulnerable. So an example of where we see how timing matters in terms of pesticide exposure comes from studies of the organochlorine pesticide DDT. So this was widely used in the United States from about 1945 to 1970, and then it was banned. But studies have shown that if you were exposed to DDT during the prenatal period before you were born, and also before you entered puberty, you had an increased risk of premenopausal breast cancer. And if you were exposed to DDT later, after you had already gone through puberty, you didn't have an increased risk of those early onset breast cancers, but you still had an increased risk of breast cancer later in life. So when you experience the exposure really matters as well. And then to make matters even a little bit more complicated, we have evidence that pesticide exposures can impact your health even before you were conceived. So there's recent data showing that DDT exposure that your grandmother experienced when she was pregnant with your mother affects your risk of developing breast cancer. And so even though DDT was banned for use in the US in 1972, it's really left behind this toxic legacy through inheritance. And we call this transgenerational inheritance. And we see this not only for pesticides, but for other chemical exposures, as well as non-chemical exposures like stress. So we don't use DDT anymore, which is a really good thing, although it still persists out there in our environment and our food supply. But we've replaced those chemicals with others. And so when I speak to communities, people are often shocked to learn that we have an abundance of scientific evidence that demonstrates the toxicity of the pest control chemicals that we're still using in our homes today. And unfortunately, we apply in the United States about 1.1 billion pounds of pesticides each year. 70 million pounds are estimated to be applied across 88 million homes and gardens. And the majority of these, the ones that are most heavily applied in particular, show adverse health outcomes and environmental toxicity. So, for example, the most commonly applied herbicides, 2,4-D and glyphosate, are associated with neurotoxicity, cancer, and hormone disruption. And despite this evidence of harm, pesticide usage has dramatically increased in recent decades. So here you can see the massive, in many cases, more than 20-fold increase in the use of glyphosate. Again, the most commonly applied herbicide used in agriculture in this country, in many areas across the country. And so what are the health risks of this chronic pesticide exposure that we're all experiencing? And so we have strong evidence of increased risk of things like neurodegenerative diseases, heart disease and stroke, and some cancers in agriculture workers and pesticide applicators who are exposed to higher levels of pesticides than the general population. But we also see these outcomes in children who are exposed to much lower levels of pesticides. And we have a number of studies that support a link between pesticides and things like respiratory problems and asthma, as well as impaired neurodevelopment and increased risk of childhood cancers. So these are just a few examples of studies that find exposure to pesticides during pregnancy and early childhood impairs cognition and behavior. Notably, a study by Columbia researchers found not only changes in behavior in children exposed to the organophosphate chlorpyrifos during fetal development, but also changes in brain structure by MRI. And that's a really remarkable finding, to be able to see actual changes in the way that the brain looks by MRI due to, what are sort of lower normal population levels of exposure to a chemical. Organophosphates were banned for residential use, largely due to those studies and those findings. But in many cases, they've been replaced by pyrethroids and neonicotinoid insecticides. And unfortunately, those replacements are also proving to be harmful to the developing nervous system, with studies showing decreased IQ and behavioral problems in exposed children. And again, just to emphasize that these exposures are in the range of what the general population experiences. So again, highlighting that low dose chronic exposure during these very sensitive windows can impact brain development. So I think June mentioned that I got my doctorate in neuroscience. And so I like to think about, what is the biological mechanism for something like this? Is this really plausible that these chemicals could have this impact? And it actually makes a lot of sense biologically, because many insecticides are actually designed to be toxic to the nervous system of the pests that they target. And we see, so, for this reason, I think we see associations between things like learning impairments and behavior and neurodegeneration. And when we look at studies in cells and animals, we can really break down the mechanism to show that a lot of these common chemicals interfere at very specific places in the ways that neurons communicate and talk to one another. So we also have strong evidence that links high-level occupational exposures to pesticides to increased cancer risk. And we also have evidence that pesticide exposure increases risk for childhood cancers. And I already mentioned the studies that show that DDT exposure early in life is associated with up to a 5-fold increased risk of breast cancer later. But we also see that other common pesticides are associated with increased risk of cancers that generally appear in childhood. So things like childhood brain tumors, increased risk of childhood leukemia and lymphoma. And we see this based on studies where mothers are asked to report the pesticides that they used around the home during pregnancy, as well as in the increased risk of many of these cancers in children who live close to farming communities or whose families work in the agricultural business. And so I wasn't going to talk specifically about too many pesticides, although, you know, we can talk about that later, about too many specific pesticides, but I think it's really worth mentioning a little bit about glyphosate-based weed killers, because these are some of the chemicals that are applied most heavily in our communities and that you see so commonly when you go into the hardware store and look at the pesticide aisle. And so these glyphosate-based weed killers, you likely know that this is the active ingredient in the herbicide Roundup. They're used widely in agriculture, and so they're detected on most of the soy and corn that's grown in this country, but also on some of the packaged foods that get to us through the store. So including things like packaged bread, and also, you know, most troubling, Cheerios and oat-based cereals that children consume a lot of. Glyphosate gets into the body, so we don't have really good biomonitoring studies for glyphosate yet, but those are starting to increase. So the CDC studies that I mentioned earlier have not had a good assay to look at glyphosate exposure in the general population. So that's something that we're still kind of getting a handle on, but we do know that applicators have detectable levels of glyphosate in their urine. And this is particularly concerning because glyphosate has been classified as a probable human carcinogen by the World Health Organization. And we also see evidence of hormone disruption, neurotoxicity, antibiotic resistance, and birth defects. And, you know, it's likely that because of its widespread use, all Americans have some level of glyphosate in their bodies. And so the carcinogenicity and safety of glyphosate has really been subject to great debate. I'm sharing this information with you, but you know that you can still go buy it and apply as much of it as you want to your yard right now if you would like to. And this debate is largely due to the influence of the pesticide industry, but nevertheless, we have increasing evidence from peer-reviewed, very reputable studies and laboratories showing an increased risk of cancer, specifically non-Hodgkin's lymphoma, and particularly in agricultural workers and pesticide applicators. And you may be familiar with the case of the California groundskeeper, Dwayne Lee Johnson, who made a lot of headlines 2 years ago when he won a settlement against Monsanto for causing his non-Hodgkin's lymphoma. And then it's not only the active pesticide ingredients that can have health effects, but in some cases, the active ingredient actually comprises less than 1% of the total formulation if you read a pesticide label, and 99% is made up of other proprietary ingredients that the manufacturer is not required to tell you what it consists of. But one of the other ingredients, non-active ingredients that we have concerns about is something called piperonyl butoxide, or PBO, which is a pesticide synergist. So it's added to a lot of pesticides, particularly pyrethroids, because it actually increases its potency. It's been classified as a possible human carcinogen. And we know from studies in humans that prenatal exposure is associated with increased risk of respiratory problems, risk of asthma, and impaired neurodevelopment. And then when we look at the mixtures that are within pesticides, and this is partly why I alluded to the idea of looking at multiple exposures and mixtures and the exposome, is because when animals are treated with the full formulation of Roundup, we actually see different and sometimes worse impacts than treating animals with just glyphosate alone. So this suggests that we really need to be looking at the impact of the full formulation on health, but actually when toxicity studies are done to prove safety by the pesticide industry, they're only looking at that active ingredient in isolation. And then thinking beyond the direct impacts of pesticides on health, I think it's really important to consider the indirect impacts that wide-scale use of pesticides has on climate change and all of the associated health outcomes that come along with climate change. So we have changing pest control needs. You may notice that mosquitoes are around later into the fall and ticks are out earlier in the spring. And so we have this increased need for better insect control measures as their active seasons are longer. Pesticides are also thought to be one of the culprits that are affecting soil and ocean biodiversity. And so this is reducing the capacity of both soil and oceans, which act as major carbon sinks to pull carbon out of the environment. And we also see that, the production of, I mentioned, over 1 billion pounds of pesticides that are applied in the US alone is very reliant on petroleum-based chemicals, as well as energy and water use. So all of these things have the potential to contribute to climate change, and then also impact all of the health effects that we're seeing, like increased risk of heat illness, increased allergy and asthma. I don't think I need to probably tell you all about what's going on with this current allergy season. Increased risk of insect-borne illnesses, extreme weather, and disruptions to the food supply. So there is good news through all of this. And we actually do have scientific evidence to support simple steps to reduce pesticide exposures. So in addition to not using them on your own property, things like removing your shoes at the door, washing your hands, keeping a dust-free home, and choosing foods that are grown without pesticides can really effectively reduce your personal exposures. And many of the pesticides that we use today leave the body quickly. So making small behavioral changes like the ones that I just described can help you to rapidly reduce your pesticide body burden. But an even more effective way to affect change is to reduce exposures on a broader level through using your power as a consumer. We've seen a massive increase in the availability of organic products, for example, and hopefully also, landscape companies who are willing to try organic strategies. And then lastly, stronger regulations have been shown to effectively reduce pesticide exposures at the population level. So I talked a little bit about chlorpyrifos. Chlorpyrifos was actually banned for residential use. And subsequent to that, children in New York City saw a 10-fold reduction in their exposure to pesticides because chlorpyrifos was used as a cockroach abatement in New York City apartments. And New York State actually just recently became one of a handful of states to ban chlorpyrifos use for most agricultural practices. So even though chlorpyrifos was banned on a federal level for use in homes, it's still permitted to be used in agriculture. And so, one of the final things that I wanted to say, I just before this talk snapped a photo of the clover on my front lawn. And I think, one of the best strategies and one of the things that I think you're working on in Larchmont-Mamaroneck with the Healthy Yards Pledge is to normalize, not having a perfect green lawn. And I had a mini success story also coincidentally today. My next door neighbor approached me. And we have very small yards, very, very close to one another. So kind of what you do on your yard is seen by everyone. And what you put on your yard is like and fuller. Our organically maintained yard is much greener and fuller than his yard that he's been applying synthetic pesticides to regularly. And he said, I gave up, I fired my guys, and I'm going to go with what you guys have been doing. That chemical stuff wasn't working anyway. So I feel like this was a major success. And, if we can just keep normalizing and putting out your flags to show your neighbors that it's okay, this is actually a good thing to have all this clover. And so, ending again on the good news, we're seeing an increasing number of communities who are implementing legislative and voluntary pesticide bans. New York City and Philadelphia, major victories. They just passed legislation that will nearly eliminate all synthetic pesticides in those cities. And the exposomics research that we're doing is also showing us how positive exposures, so things like good nutrition and physical activity and access to green spaces, can actually mitigate some of the risks of chemical pesticide exposures. And so before I take questions, I just want to invite you all to join us at Mount Sinai for 2 upcoming webinar series that may be of interest. So the first is a forum that is going to be held across 5 days, beginning next Monday, May 24th. We are co-convening the Cultivating Healthy Communities annual pesticide forum with Beyond Pesticides. So there's going to be a really rich and diverse program there with soil scientists and organic land management and health-based talks. And then we're also through the Mount Sinai Institute for Exposomics Research, where I am, we are hosting weekly lunchtime chats at 1 p.m. And those are continuing through June 9th. So I just want to wrap up by acknowledging, not only the research institute that I am at, but also the clinicians that I work with through the Pediatric Environmental Health Specialty Unit and the New York State Children's Environmental Health Centers. And I wanted to specifically make you all aware of this statewide network. If you're not already aware, Mount Sinai is the data coordinating center for 7 sites across New York State that have expertise in children's environmental health, who help to prevent, diagnose, and treat illness that result from environmental exposures. And for those of you in Westchester, which I think most of you are, there is a Hudson Valley Center, which includes New York Medical College and Westchester Medical Center. And then a lot of our work is supported by some large center grants from the National Institute of Health, so that we can translate all of the research that we're doing for communities. And so lastly, you can get more information about the work that we're doing, learn more about pesticides, as well as other harmful exposures, and even some resources for children at our website, and by following us on social media, both our research centers, as well as the New York State Children's Environmental Health Center and our pediatric specialty unit. And if you would like to be added to our mailing list, get more information about the upcoming events that I mentioned, you can email us at chc@mssm.edu. And so I think with that, I will close and we can take questions.
Okay, we got thanks for that. We got a number of questions in the chat. Dr. Evans, what can be done if illness is diagnosed in a child or an adult that is attributed to pesticide or other environmental chemicals? Is it too late once exposed?
Yeah, that's a great question. And I kind of alluded to that a little bit in terms of things that you can do. And it's something that has not been really looked at systematically, but something that we are looking at in the Exposomics Institute. So like I said, not everyone who is exposed to a chemical will have the same physiological response. What we think, particularly where we think about neurotoxicity, is that we know from animal studies that you can mitigate some of the risk experienced by doing, by creating an enriched environment, essentially. So providing lots of opportunity to build brain connections. And, there's a lot of good news. It's actually why I was so interested in neuroscience from the beginning, that your brain does remain pretty plastic. It loses plasticity as you age, for sure. It's most plastic when you're youngest. But, it typically is not too late to try to support more brain growth. And then in terms of other outcomes, there are benefits. We don't fully have a handle on it yet. But there are benefits of things like good nutrition and physical activity, and even access to green spaces, believe it or not, that can help to mitigate some of the effects. So I think creating, when you learn later, as often happens, you learn later that you had an earlier exposure to something harmful, creating sort of the cleanest and safest environment that you can, beginning from that moment, can have positive impacts.
Okay, what is the single best thing to do to reduce toxic exposure to our families?
Oh gosh, I feel like depending on the day, I have a different answer to that question. I think, for me, and the way that I've seen it happen for a lot of families that I speak with, is that you start very small and identify, what you can do right now. And that might be, now we're thinking maybe outside of thinking about pesticides, but it might be looking at the things that you're using in your kitchen, and are you preparing foods in plastics or heating foods in plastics, which can expose you to endocrine disrupting chemicals. And maybe that's an easy thing to do. Maybe you're using a lot of cosmetics or personal care products that contain high levels of chemicals, and you can make a switch. So we know a lot of things, like switching over to organic foods, like stopping use of pesticide chemicals in your home and on your lawn, and making those kinds of swap outs. Like I said, many of those chemicals leave your body very quickly. So by making those small changes, you can have an impact. And, once you start, it's sort of a snowball effect. You start to realize all of the things that you're exposed to and make little changes at once. So I wouldn't say do everything at once. I would say, identify what you can do and do it sort of stepwise. And we have a lot of information, I still have the slide up here, information about different types of exposures, like I mentioned, plastics, outdoor air pollution, indoor air pollution, that I think could get you started. And we always try to give information in terms of simple steps. So things that are free or very affordable and easy to do.
Are there specific product and brand names you can mention so that residents know what to avoid when they go to a local garden center or hardware store?
That's a hard question. I'm not technically, as Mount Sinai faculty, I'm not allowed to mention brands. I look for, though, you can look for things that are OMRI certified, so certified for organic gardening. That's one place to start if you're thinking about, what to do in your yard. And I think June referred to the Healthy Yards website, which I think is probably a very good resource for other things you can do. I know just from what we've done around our own yard, that there are a lot of inexpensive and chemical-free strategies that you can use in your garden.
Okay. How do we get rid of the pesticides that we don't want to use? I don't want to just put them in the trash.
Yeah, that's a good question. Usually your local waste transfer station will have like a hazardous waste day. And so I would recommend holding off and then bringing them to the hazardous waste day or hazardous waste facility. I definitely would not recommend dumping them down the drain. That can be really tricky though.
Okay. Have you found that once patients understand the connection to pesticides and health, that they are likely to refrain from that product usage?
I think that everyone has a different reason. Sometimes health information does not resonate with people. And I found that, where some people might not believe the health evidence, they're concerned about the health of Long Island Sound, or they're concerned about their pet. And so it's actually their vet telling them that this is not safe and healthy for your dog, that triggers them to make a change. So I think everyone responds a little bit differently. And like a lot of environmental exposures, pesticides are really multifaceted. And so I think, while my expertise is in health, I often like to speak alongside or refer people to other resources where they can learn, for example, about the environmental impacts, which are also a huge concern.
Okay, so OMRI certified is a label to look for?
Yeah, so that means that it has been approved and certified for use in organic gardening. And that might be something that someone on this call knows more about than I do. But yeah, so I think that is a label that you can find on products that you use on your lawn and in your garden that will not contain a harmful synthetic pesticide.
Okay, we have another number of questions about alternatives to pesticides for their lawn. So I don't know what you feel about those questions, but.
Well, I think like June said, finding the resources through her website, and maybe she can mention that again, the website again. I know there are things. Well, I guess my sort of strategy is that if it's green, it's okay. My lawn looks very green from a distance, even though there are a lot of weeds in it. So not needing to have the perfect lawn, I think is really helpful, and sort of normalizing that in your neighborhood. And And then I know that there are a lot of chemical-free strategies that I'm not an expert in, but, things like aerating your lawn and overseeding and things like that. But I think those resources are available through Healthy Yards.
Okay.
June, do you want to say the website again? You can go ahead and.
It's www.lmhealthyyards.org. And I know we were going to put all questions in the chat, but I'm wondering, Dr. Evans, you spoke quite a bit about pediatric exposure and effects. Are there some, is there anything else that you're sharing with patients and looking at in your research for adults, pregnant women, for example, or hobby gardeners, people who are outside in the yard very much?
Yes, I mean, I think, in terms of adults, a lot of the focus has been on occupational exposures, which are higher level than the average individual. Pregnant women, yes, definitely one of the most vulnerable periods for exposures to pesticides as well as other chemicals. And certainly pregnant women working in industries where they might have increased exposure are very much at risk. So yes, that is something that we look at. And when we, it's fairly complex, but studying the exposome does study across the lifespan. I mentioned that there's this issue of timing. And certainly there are times when, times outside of childhood and young adulthood when the systems are more vulnerable. So one of the, in breast cancer research, there are concerns about menopause and pre-menopause, that women may become more susceptible to some of these chemicals than they were at other stages because they're undergoing a lot of changes hormonally, and many pesticides and other chemicals interfere with hormones in the body. And a lot of those, I didn't talk too much about disruption of hormones, but hormones regulate basically all of the functions in the body. We think about estrogen and testosterone, but we also have thyroid hormone, and they don't only impact reproduction, they also impact brain development very much, brain function, the digestive system, basically anything that you can think of. And hormones are really tightly regulated. So if you throw them out of balance just a little bit, you can have dramatic impacts. And so a lot of these chemicals, they talk about trace residues on pesticides, or you're only exposed to a little bit of this and a little bit of that. But that when you're talking about interfering with hormonal systems, those low levels can really have an impact. But so, to sort of answer your question about the life stages, anytime during a life stage where your hormonal balance is really critical or changing, represents kind of a vulnerable period.
We've got another question in the chat. I find that many folks are reluctant to believe the connections between pesticides and health impacts, especially since they don't see the direct cause and effects. How do you convince people that that latent effects are real?
Yeah, that's really hard as well. And, again, that sort of, it's on the shelf, so it must be safe mentality. We have a preponderance of evidence, and I think you cannot convince everyone, but if you can convince the legislators, then that's a huge victory. And so the pesticide industry, like the chemical industry in general, lobbies very hard. And the scientists need to be there, and the community members and advocates need to be there to counter argue. And so, one of our strategies has been to compile all of the evidence and bring it to the policymakers, so that when industry shows up with all of their statements saying there are no health impacts, we have the stack of paper showing yes, there are health impacts. and identifying legislative champions who will help to push those bills forward. And New York State has been better than some in that regard. So I think, it's really tricky. People don't want to hear it. And so I would say go beyond the individual level, try to get most of your community on board and then push with policymakers.
Okay. Our community, I'm not in Larchmont, has a mosquito spray evening in summer. Every Tuesday, a truck drives through and sprays only the homes that agree to this spray. Doesn't this have an effect on the whole community, even if the spray is not directly on your property?
Yeah. So pesticides really don't stay where they're sprayed, and they drift. And, in particular, if there's a little bit of a breeze, spraying for mosquitoes is really ineffective. So, hopefully you hit one when it flies by. But so that's frustrating because, not only are there potential health impacts, and yes, they will affect someone else's yard and home who didn't agree to the spraying for sure. But it's not even really an effective strategy. And so, there are much better things that you can do for mosquitoes, like putting out larvicides, like eliminating standing water. Larvicides are much safer than the adulticide insect sprays. And so I would, encourage you to go to your community and whoever runs that program and, sort of demand that they target the larvae and maybe present them with information showing that that's not even an effective strategy. And then in the meantime, keep your children and your pets indoors and close your windows.
Okay. You mentioned strawberries, apples, and oat cereals that have higher levels of toxics. Are there others that we should be aware of? Does washing fruits significantly reduce exposure?
Yeah, so the Environmental Working Group, which is a really great advocacy organization, tests a whole range of produce for pesticide residues. And that's one of the ways that we have a good bit of information about which are the most contaminated and least contaminated types of produce. They call it the Dirty Dozen and the Clean 15. You may have heard of that. And so they have a website, ewg.org. And every year they retest produce, and the, which are the most contaminated kind of shifts around a little bit. Unfortunately, it's a lot of the softer, fleshy fruits that kids really like that are more contaminated, but it's a nice resource because you can choose when you have to choose. Maybe you don't have the budget to buy everything organic, but when you maybe you get strawberries organic, but then there are other things that are, like I think bananas and some of the harder skinned fruits that are less contaminated, and you don't have to think as much about buying those organic. Unfortunately, the pesticides really permeate the produce, and there's not great evidence that washing them, like definitely the fruit sprays are not really worthwhile. You should wash to remove bacteria, but there isn't much good evidence for washing to remove pesticide residues completely.
Lawn services post little flags and lawns after pesticide application, advertising that residents stay off the grass for 24 hours. What is the real safe time? Is it truly just a day?
No, it's definitely not just a day, but it depends a lot on the weather conditions, how wet it is or how windy it is. And glyphosate has been shown to remain in soil for up to a year post-application. So we really, I can't even really reliably give an answer, unfortunately. I think, it's really kind of false reassurance to have the yellow flag and then say, okay, in 24, 72 hours, you can go back onto the lawn. I'm not reassured, and we can't really say how long it's staying there.
Okay. I think we're pretty good with questions here. Does anyone else have any questions for the chat?
Thanks so much, Dr. Evans, for all of that information. It's quite unnerving for many of us. I think that the example of the truck that passes through a neighborhood or a community on a weekly basis, spraying is very frightening. So can we come to or rely on your department or Sinai Exposomics for information to share with our legislators or decision makers in our community to support our request that our municipalities no longer use any type of pesticide?
Yeah, so that's something that we do a lot of work at the community level and the state level to advocate for, more protective practices and policies. So, that's partly why we started to generate a library of materials that people, advocates, community members could access and sort of bring forward and say, this is the information that's coming from the Mount Sinai Institute for Exposomics Research. But yes, and we also often provide written or oral testimony, related to topics that we have expertise in. And so that is something that, again, you can find us through all of these various channels one way or another. If you are looking for support for your community, if you're looking for, other outreach events related to environment and health, that's something that we are here for and that we value very much.
Great. Thank you so much.
There is one more question. Decades ago, we passed the neighbor notification law in Westchester that's supposed to require neighbors to be notified before a pesticide application, but I've never seen it observed. What can we do as communities to get it enforced? I don't know if you can answer that question. June, that might be more for you.
Yeah, I don't really have a clear answer. I just know that is an issue. I don't know exactly how it works in Westchester, but I know in Connecticut you complete a form and you ask to be on the notification registry, and the commercial applicators are supposed to notify you, and I think your neighbors, at least in Connecticut, are also supposed to notify you. And I don't think that ever happens. But I would, take that to probably the state DEC oversees that kind of policy and find out what you can do about it. But I do agree it's kind of a empty policy.
And someone said that their friend received the notification from the village of Mamaroneck, so maybe it is working somewhat. And someone is asking about pesticide, I guess fertilizers. Is that this, just as bad as pesticides? Lawn fertilizers?
Yeah. So again, not an expert in that area, but what I do know is that many fertilizers are mixed with like pre-emergent herbicides. And a lot of landscapers don't tell you that, which I think is really egregious. And so you think that you're just applying fertilizer, and actually it's mixed in with toxic chemicals and herbicides. I live very close to the Sound. And so, for that reason, because of the health of the Sound and the runoff, I don't favor fertilizer. But, fertilizer in and of itself, I don't know of human health toxicity that's associated with just fertilizer itself. It's just often it's not just fertilizer, I guess would be my answer. June, if you have anything to add to that, feel free. But
we do address this to some extent on the healthy www.lmhealthyyards.org webpage. I do actually want to toss in one more question, which came up, and Dr. Evans, I don't know if you have research on this specifically, but we did speak earlier about ticks, And, you know, cedar oil is one of the options recommended for tick treatment. I think that is perhaps a whole discussion for maybe another time, because like mosquitoes, you know, it's very situational. You may knock out a few with a pesticide, but this is an ongoing. Ticks come into a yard and mosquitoes come into a yard on an ongoing basis. But do you know anything about cedar oil specifically?
I don't know of any known health effects. You know, cedar oil is felt to be very safe for use and safe for use around children and pets. I know I've had a question of whether there are allergy concerns with cedar oil, but I have never heard of that. You know, for people who have, some people are allergic to evergreen, you know, and pine sap and things like that. That's not something I've ever heard of. So I think that it's a safe option. You know, I think, and there's a fact sheet right here on the slide that we have about protecting your family from ticks. We do have a researcher at Mount Sinai who is an expert in tick-borne illnesses. So he's a really great resource. But there are a number of strategies that you can use. I grew up in Connecticut, so I've been surrounded by this issue my whole life, and never lived very close to the woods and grassy areas, you know, and have not contracted a tick-borne illness, and we had never used any chemical treatment. So obviously vigilance, and the clothing that you wear, and you know, the way that you maintain your lawn, and not having, you know, piles of brush and wood where ticks like to live. There are a lot of non-chemical strategies that you can take without having to apply synthetic chemicals to your lawn. So, you know, we recommend all of those lines of defense. I get a question a lot about personal repellents, particularly from families whose kids are going off to camp in the woods, and they're very concerned. And there's a very real threat to tick-borne illnesses. And, you know, their activity is becoming less predictable because of climate change, and they're being found basically everywhere you look. So, you know, we do recommend, you know, as another line of defense, if you need an insect repellent, you know, people are often surprised to hear that DEET has a pretty good safety profile and has been tested in pregnant women and children and utilized for many decades. You know, one of the key things about that is that you can, if you need to use it, you can minimize exposure by like only applying it to exposed skin, not, you know, applying it indoors so that you're breathing it in and keeping it away from hands and faces. But, you know, I know that there are some people and children are in areas where, you know, ticks are a major threat, and they might need that. And so using, you know, particularly like 20% DEET, not more than 20% DEET, and, you know, because you can buy products that are 100% DEET, that would not necessarily be safe. But, you know, a personal insect repellent sometimes can be, you know, a necessary strategy to avoid that risk of a tick bite. And another one is oil of lemon eucalyptus. That one has been shown to be very effective and safe for use, you know, and maybe a more natural option. It hasn't been studied in children under the age of 3. It's kind of a strange thing. So not that there's a known risk, but it's not recommended for children under the age of 3.
Great. Okay. And thanks to Nikki Coddington and Elizabeth Poirier for your comments as well about shrubs and yard approaches to minimize presence.
Mm-hmm.
All right. And thank you, Paul, for managing the Zoom for us. There was lots of good information. And Dr. Evans, we will send up a follow-up note to all the registrants, including some of the social media for Sinai and Sinai Exposomics, so that everybody else knows exactly where to go for more information.
That's great. Okay. Thank you.
Good night, everybody.
think we're good to close down, June?
Yes, thank you so
All right.
much.
All right, thanks. I'll close now. Have a good night. Thanks.